Hello everybody. Now the male genital system which includes the testes, vas deferens, seminal vesicles and ejaculatory ducts. Among all these things, today we will discuss on the testes. Now the testes are a pair of male reproductive glands which are ellipsoid in form and which are suspended into scrotum by the corresponding spermatic cord. The left testis lies about 1 centimeters below the right one. That means the right and left testes are not at the same level. The left testis hangs down 1 centimeter below the right one. Next thing, the direction of the testes are placed obliquely in the scrotal sac. Coming to the measurements, the average measurement of an adult testis is the length is about 5 centimeters, the breadth is 2.5 centimeters, thickness is 3 centimeters, and the weight of the testis is about 10 to 14 grams in weight. The testis presents the following parts, like it has got two ends. One is upper end, number two is lower end. It has got two borders. One is anterior border, number two is the posterior border. It has got two surfaces. One is medial and number two is lateral surfaces. Now, the upper end of testis is overlapped by the head of the epididymis and connected to the efferent ductiles of epididymis. Next, the upper end, it gives an attachment to the fibrofatty body which is known as appendix of testis. Now coming to the lower end is connected to the tail of epididymis by areolar tissue and tunica vaginalis. The anterior border is smooth, convex and free, whereas the posterior border is flat, occupied posterolaterally by body of epididymis and posteromedially by vas deferens. Not only this, the spermatic cord is attached to the upper part of posterior border of testis. Coming to the surfaces, the medial surface is smooth and convex. The lateral surface is smooth, convex and overlapped posteriorly by epididymis. Now the difference is nothing but the medial surface is smooth and convex, the lateral surface is smooth and convex, both are same. But on lateral surface you will see the lateral surface is overlapped posteriorly by the epididymis, and this epididymis is separated from the lateral surface of testis by a small semilunar recess of vaginal sac which is called as sinus of epididymis. Sinus of epididymis, and this is very important because this sinus of epididymis helps in determination of the side of the testis. So always the sinus of epididymis should be placed laterally. Now in this slide you are seeing two views of the testis. The right side is the lateral view of testis and the left picture is the posterior view of testis. So in the right side picture, which is a lateral view, you are seeing the upper pole is overlapped by the head of the epididymis, which is marked with B. Then posterior border and the lateral surface is occupied by the body of epididymis, and the inferior pole, which is marked by C, and the inferior pole is connected to the tail of the epididymis, which is marked as D. Now in the same picture, the right side, which is the lateral view, this lateral surface is separated from the body of the epididymis, which is C, by a semilunar space, semilunar sinus, which is called as the sinus of epididymis. So the sinus of epididymis is nothing but a gap, and this sinus of epididymis is separating the body of epididymis from the lateral surface of the testis. In the left picture, if you observe, which is a posterior view of the testis, now in this picture you observe that the posterior border of the testis, as I said, it is broad and flat, and this posterior border is occupied, you can see there very clearly, which is occupied by the the body of epididymis, which is posterolaterally, and medially posterolaterally, which is marked by C, and posteromedially the posterior border is occupied by the vas deferens, which is marked by E. So the left picture is posterior view and the right picture is lateral view, and in the right picture lateral view you can see very clearly the upper pole occupied by the head of the epididymis, which is B, and the lower pole is connected with the tail of the epididymis, okay, which is marked with D. Next thing, the lateral surface of the testis is separated from the body of the epididymis by a semilunar sinus, which is called as the sinus of epididymis, where you can see, which is very clearly marked with the C. Now the coverings of testis, if you see, now each testis is presenting with 3 coverings, and these are from inside to outside. If you see, you will have 3. One is the tunica vasculosa, tunica albuginea, tunica vaginalis. These are the layers which are covering the testis from inside to outside. I repeat, from inside to outside: tunica vasculosa, tunica albuginea, tunica vaginalis. Okay. Now coming to the tunica vaginalis, which is the outermost covering. This tunica vaginalis, which covers the testis and also epididymis, except the posterior border. So it only covers it, except the posterior border of testis, it covers the entire testis. And not only that, this tunica vaginalis has got 2 layers. One is the visceral layer, and number 2 is the parietal layer. Between the visceral layer and the parietal layer, it forms a closed sac, which is called as vaginal sac. Next, the tunica albuginea. So this tunica albuginea, this is a thick fibrous membrane which covers entire testis. It covers the entire testis, and this tunica albuginea, it projects into the organ. It projects into the interior of the organ, that is testis, from the posterior border as an incomplete vertical partition known as mediastinum testis. Now, from the anterior surface of mediastinum testis, numerous fibrous septas radiate and divide the testis into numerous compartments, and these numerous compartments, which are cone in shape, and these are called as lobules of testis. And there are about 200 to 300 lobules are present in each testis, and in each of the lobule we will see the seminiferous tubules are present. Next, coming to the tunica vasculosa. Now the tunica vasculosa is innermost layer or innermost covering of the testis, and this is areolar and vascular membrane and lines the individual lobule of testes. Clear? So these are all about the coverings of testis: tunica vaginalis, tunica albuginea, tunica vasculosa, which is a vascular membrane which lines the individual lobule of the testis. Now the macroscopic structure. Now you all know that this testis is divided into 200 to 300 lobules by the projection of the tunica albuginea into the organ, the testis, and divides this entire testis by the fibrous septas into some conical shaped lobules, and these lobules are about 200 to 300. Now this each lobule of testis contains 1 to 3 seminiferous tubules and interstitial cells of Leydig, and You know, as the seminiferous tubules are highly coiled structures, if you uncoil, the length of the seminiferous tubule will be about 2 feet. And here, as I said, that in each lobule you will see 1, 2, 3 seminiferous tubules. So in average, if you take, the total number of seminiferous tubules in one testis is about 400 to 600 in number. Now, the seminiferous tubule will have two parts. One is the convoluted part and number 2 is the straight part. The straight part, which is present behind, these straight parts of the seminiferous tubules, they ascend in the mediastinum to join with the adjacent tubule and forms a plexus of network of tubules which are known as rete testis. Okay. Now, about 12 to 20 efferent ductiles arises from the upper end of the rete testis and enters the head of the epididymis. The arterial supply of the testis, it is mostly supplied by the testicular artery, which is a branch of abdominal aorta. And not only that, the testis is partly supplied by the artery to the vas deferens, which is a branch of the superior vesicular artery, and sometimes the testis is also supplied by the cremasteric artery, which is a branch of inferior epigastric artery. Yeah, coming to the venous drainage. Now, about 15 to 20 veins appear from the posterior border of testis and epididymis, and these will unite to form the pampiniform plexus, which produces the bulk of spermatic cord. As you all know that the contents of spermatic cord, one of the content is the pampiniform plexus of the veins. Now, these pampiniform plexus of the veins at the superficial inguinal ring, these plexus unite to form 4 veins. All plexus will unite to form 4 veins, and at superficial inguinal ring. Now, at the deep inguinal ring, these 4 veins further join to form 2 veins. And finally, a single vein is formed in the posterior abdominal wall, and one is right and left testicular veins. The right testicular vein drains into inferior vena cava, and the left testicular vein will drains into the left renal vein. Is it clear, everybody? So first, initially we get the plexus, pampiniform plexus of the veins, and these pampiniform plexus of the veins, on reaching to the superficial inguinal ring, they will unite to form 4 veins, and these 4 veins, on reaching to the deep inguinal ring, they will again unite to form 2 veins, and finally these 2 veins again they unite to form a single vein, and this single vein, right testicular vein and left testicular vein. Right testicular vein will drain into the inferior vena cava, whereas the left testicular vein will drain into the left renal vein. And now the heat conveyed by the arteries of the testes is mostly absorbed back by the veins of pampiniform plexus. So whatever the heat which is conveyed by the arteries of the testes, that heat is absorbed back by the pampiniform plexus of the veins, and eventually the scrotal temperature of the testes is about 3 to 4 degrees lower than the abdominal temperature, and this mechanism of heat transfer is known as counter current heat exchange. So what is the function of the pampiniform plexus of veins? This pampiniform plexus of the veins will absorb the heat which is conveyed by the arteries of testes and maintains the temperature of the testes within the scrotum. The lymphatic drainage of testes, if you see, the lymphatics drains into pre-aortic and para-aortic lymph nodes, which follows the course of the testicular blood vessels. Yeah, the nerve supply, if you see, the testis is predominantly supplied by the sympathetic nerves from the renal and aortic plexus. The preganglionic fibers are derived from the 10th and 11th thoracic segments of spinal cord. The clinical aspects, if you see, one condition which is called as the anorchism. Anorchism means absence of testis. If the both testes are retained in abdomen, or if they are failure in development, that condition we call it as anarchism. Next we have one which is called as monarchism. Monarchism is nothing but one testis, if it is present, if it is called as monarchism. And one more term also which is called as cryptorchism. This cryptorchism is nothing but which is defined as the undescent of testes. That means testes will remain in abdomen and they will not reach down to the scrotum, and the condition is called as cryptorchism. So anarchism is absence of testis, monarchism is presence of one testis, cryptorchism means undescent of testis is called as cryptorchism. Next we have one more condition which is called as the ectopia testis. Ectopia testis is nothing but the testis leaves the abdomen but do not reach the scrotum. It leaves the abdomen but it does not reach the scrotum because of the pull of the gubernaculum. It may not be reaching to the normal site where in the scrotum, and they may be present in front of the penis, or sometimes they may seen in the penis which is called as prepenile. It is present at the prepenile, or it may be seen in the femoral region also. Next thing we have inversion of testes. Inversion of testes, here what happens, sometimes the processus vaginalis extends behind the testis and makes the posterior border of testis free. Usually the anterior border of testis is free, but it's in the inversion of testis, what happens, the posterior border will be free and anterior border is occupied by the epididymis. This is all about the testis. Now coming to the epididymis. Now epididymis, it is a comma shaped body situated along the lateral part of the posterior border of testis and consists of head, body and tail. Head is formed by the coiling of efferent ductiles. Now each coiled mass is conical in shape and forms a lobule of epididymis. Okay. Next, sometimes the head gives attachment to a pedunculated body which is called as the appendix of epididymis. Next, the body and the tail of epididymis are formed by coiling of a single duct. From the tail, the vas deferens begins as a continuation of a canal of epididymis. This is all about the epididymis. Epididymis is nothing but which is a comma shaped structure which has got a body, head, body and tail, and the tail continues as the vas deferens. Thank you. This is all about the testis and epididymis. Thank you.